Toddlers and Preschoolers. The toddler and preschool years are exciting. They are establishing independence, exploring new environments, voicing their likes and dislikes about foods and other things. Parents and caretakers need to be good role models in all areas of life, including exhibiting positive eating habits. Children ages 1 and 2 years are classified as toddlers, while those 3 to 5 years are classified as preschoolers. Now let's take a look at growth and development. Toddlers and preschoolers grow at a slower rate than infants. After the first year, growth slows, but the body continues to change dramatically. The average annual weight gain is only about 4.5 to 6.6 pounds. And the average annual height gain is only 3 to 4 inches between the ages of 2 and 5. An anthropometric assessment is done to monitor growth. In young children, these measures include length or height, weight for length, body mass index, and head circumference. And please note that depending on the age of the child, length is taken lying down, but if they're old enough to stand up on their own, then we will measure height. Nutritional status. Nutritional needs. Toddlers and preschoolers have reduced appetites because of slow growth, so planning a diet that meets the nutrition needs Toddlers and preschoolers have reduced appetites because of slow growth, so planning a diet that meets their nutrient needs can be challenging for parents and caregivers. Choosing nutrient-dense foods is particularly important with children who don't eat much or who are picky eaters. This is a good time to emphasize whole grains, fruits, vegetables, and moderate amounts of fat and simple sugars. Sodium intake should be limited, and you can do this by using very little salt in cooking, limiting processed snacks, limiting luncheon meats and hot dogs, and rinsing canned vegetables before heating. Skim milk or 1% milk should be introduced after the child's second birthday. And remember that before the second birthday, we want the child to primarily be on whole milk so that they can get the extra fat and calories. Limit the amount of juice to 1 to 4 Skim milk or 1% milk should be introduced after the second birthday. Remember that before that time, between the first and second year, we tend to recommend whole milk so that the child has enough calories and fats in the diet. Limit the amount of juice to only 1 4-ounce serving daily. Remember, juice is not a nutrient-dense food, and too much will spoil the child's appetite for nutritious foods and add calories without adding significant nutrients. This table shows the My Pyramid plan for this age group. A rule of thumb for estimating serving sizes for young children at a meal is 1 tablespoon of each food per year of age. For example, A 1-year-old would need 2 tablespoons of potatoes. A 2-year-old would need 2 tablespoons of potatoes. A rule of thumb for estimating serving sizes for young children at a meal is about 1 tablespoon of each food per year of age. For example, a 1-year-old would need 1 tablespoon of potatoes, and a 2-year-old would need 2 tablespoons of potatoes, and so on. A multivitamin and mineral supplement is generally unnecessary for healthy children. However, it may be needed for picky eaters, and the emphasis should always be placed on healthy meals and snacks. Consuming fortified foods as well as supplements may lead to excessive intakes for some nutrients such as vitamin A and zinc. Remember that many vitamins look like candy, and accidental overdose is common. Some of them look like gummy bears. Some of them are like little jelly fun shapes or even cartoon characters. And iron overdose can occur when a child accidentally consumes too many children's vitamins. And actually, it's a very common cause for going to the emergency room. Fortified, ready-to-eat cereals with milk are helpful in filling gaps in the child's diet, especially for vitamin E, folate, and vitamin D. 2 micronutrients of particular concern are iron and zinc. And this may be due to inadequate protein, especially animal protein. Thus, we need to make sure that well-planned diets for vegetarian and vegan children are done. Fiber becomes important in a child's diet around age 3, and significant sources of fiber are fruits, vegetables, whole grains, beans, peas, and nuts. But remember choking hazards for younger children when it comes to nuts. The American Heart Association recommends the +5 rule for determining a child's fiber needs. The child's age +5 equals the grams of dietary fiber he or she should eat daily. For example, a 4-year-old child would need about 9 grams of fiber. 4 + 5 equals 9. Common nutrition problems. Some common nutritional concerns for young children include overweight and obesity, cavities, anemia, constipation, and physical inactivity. Overweight and obesity are not usually a concern until children are around 6 years old. However, good eating habits and regular physical activity should be established now. The body mass index for children fall into one of 4 categories: underweight, BMI below the 5th percentile; normal weight, BMI between the 5th and 85th percentiles; at risk, BMI between the 85th and 95th percentiles; and overweight, BMI at or above the 95th percentile. Cavities are usually due to staying on the bottle too long, eating too much candy and sweets, and poor dental hygiene. Children should have their first dental checkup at age 2 years old. Cavities are usually due to staying on the bottle too long, eating too much candy and sweets, and poor dental hygiene. Children should have their first dental checkup at age 2. But before that, good dental hygiene include making sure the child's mouth is wiped out after every meal with a damp washcloth, and wiping the baby teeth, and even using a soft toothbrush. Young children should be provided fluoridated water to prevent cavities, and also avoid sticky and sweet foods since they promote cavities, and brush after every meal. And big emphasis here is to wean from the bottle. We want to have children off of the bottle ideally by 18 months. And sometimes in practice, we've seen children 2, 3, 4, maybe even 5 years old ready to go to kindergarten and still on a bottle. Iron deficiency anemia is most likely to appear in children between the ages of 6 and 24 months. And anemia in young children is often due to drinking too much milk and not eating enough foods high in iron. Milk should be reduced to the recommended levels, and the diet should be rich in iron-fortified cereals and whole grain foods. Constipation is usually due to a diet low in fiber and not drinking enough fluids, especially water. To relieve constipation, provide fresh soft fruits such as peaches, plums, apricots, vegetables, and whole grain foods. The pediatrician may also recommend a mild laxative and stool softener, but please check with your doctor. Young children need 60 minutes a day of physical activity, and this can be broken up into small events. The big emphasis here is on active play. Limit TV and screen time. The American Academy of Pediatrics recommends no TV or screen time before age 2, no more than 1 to 2 hours per day for older children, and interactive play, and no TV in kids' room. Toddlers and preschoolers up to age 5 from low-income families may be eligible to participate in WIC and Head Start. WIC provides nutritious foods, nutrition education, and health screenings, and Head Start and Early Head Start are federal preschool programs that promote school readiness. Toddlers. 1 and 2-year-olds are considered toddlers. A toddler's vocabulary revolves around the word no. Therefore, it is not uncommon for them to say no to new foods. It is the parent's responsibility to make healthy choices for the toddler and to set limits. Toddlers are continuing to gain skills in chewing, swallowing, and using utensils. By 15 months of age, most children have developed enough fine motor skills to begin to feed themselves independently. Offer foods that are easy to swallow and chew, and introduce them slowly to prevent choking. It is important to understand that gagging is okay because it is how a child learns how not to choke, and that is the reason why children should be supervised during mealtime. Thus, it is important to not withhold difficult foods for fear of choking, or the child will never learn how not to choke. Again, that is why it is important to supervise meal times and for parents and caretakers to know infant and child CPR. Foods that are major choking hazards, such as nuts, popcorn, whole grapes, etc., should be avoided until after age 3. Preschoolers. 3 to 5-year-olds are usually referred to as preschoolers. Preschoolers are gaining skills every day and are able to communicate well and participate fully in family activities. They can help with planning the menu, preparing the meal, shopping, storing food, table setting, and cleanup. Preschoolers have the manual dexterity to use a knife and a fork by age 5. So, provide soft foods to cut and introduce table manners. Selecting the best preschool is more than evaluating the cost, cleanliness, and educational activities. Consider the types of meals and snacks that are served. Ask about physical activity programs and playtime. Look at the weekly menu. Ask about mealtime procedures. And childcare providers should not force children to clean their plate or use food to reward or punish behaviors.